David, thank you so much for joining me. Tell us, who's your mob and where are you from?
So my mom's I'm a proud Bundjalung man from far north coast of New South Wales, and all my family's up around Tweed Head, so Tweed Coast, Fingal, down the Mullumbimby, and very, very proud of my homelands, and always good to get my feet back up into my salt water up there on the Tweed Coast.
Beautiful saltwater country up there. David, for you, can you start by telling us, where did you start your career in health and where have you ended up?
Well, I could actually start my journey in health long before I even thought I was going to be in health. My mum was one of the early Aboriginal health workers within the New South Wales health system. And not long after I was born, she sort of embarked on her journey and built the Aboriginal Health Service up there in Tweed Heads, the Bulwana Service. Yeah, so I guess this was an environment I really much grew up in, and even at those times in life where I thought, well, that's mum's thing, I'll go and do my own. Destiny had its own calling on me, and sort of at every time I tried to leave this space, it sort of brought me back, which I'm quite proud of being a second generation in this space.
Obviously, you have lived and breathed the importance of our Aboriginal and Torres Strait Islander health workforce. How did the process of selecting a National Day of Recognition for that workforce come about?
I guess the one thing that really stood out through my career was how much of the backbone our Aboriginal health workers, and then when the profession of the Aboriginal health practitioners sort of emerged, were in our communities. And you'll hear the stories from the doctors and the nurses that work on the front lines with these guys, and how much praise they have. But at the same time, how much the system often doesn't acknowledge their contributions to the healthcare and wellbeing to mob, or doesn't really look into the opportunity that this, our workforce has in terms of, what they could contribute to the broader workforce too. Because our mob, really, deal with one of the, if not the most, one of the most disenfranchised communities in Australia. There's no reason why the thinking and the philosophies that are key and central to a workforce, which is our workforce. I really like to stress that our Aboriginal health practitioners are about mob, and that's very central to what they are. But there's some core thinking that will contribute to the broader healthcare system that makes it better for everybody. And I think that our profession isn't been developed that way. It's sort of been developed, for the needs of Aboriginal and Torres Strait Islander people, and those core needs of, those cultural determinants of health. The importance of community and family is central to the health and well-being of our communities, and also that understanding that an environment is also a very important part of our, health and well-being. And these are core principles that underline every Aboriginal health worker and practitioner. So they bring that as an inert part of who they are and what they are to the profession. And those who go on from our profession and into other professions, would only seek enhancement to what they are trying to achieve in their goals in terms of making, health outcomes better for mob out there.
What is the legacy so far that our health workforce has left? People like your mother.
My reflections on what sort of legacies we've got there. I think, in this year of 2021, Redfern Aboriginal Medical Service turns 50 this year, and that's a huge milestone in terms of, I guess, the key philosophy that around Aboriginal community controlled health services. Redfern AMS is the template that is used, that started the movement here in Australia, and then also. Our workforce was critical in supporting the growth of the Aboriginal community controlled health sector across the nation. I've got close ties to the birth of the Archo sector here in Redfern, and I'm very proud of that also. And then sort of reflecting, I guess, mum's journey and sort of growing up in that space and seeing that our workforce is really less about us as an individual and more about the well-being of the community. And I know mum, and even in my own career, it wasn't about hanging the hat up at the end of the day and saying, well, my shift's done for the day. It was, 24 hours, 7 days a week, but at the same time, couldn't change that either because, I guess it was a key interface between, the healthcare and, the community. And I guess the real legacy I would like to see is that we ensure that this workforce, as I've mentioned before, gets the recognition it deserves, finds its place there as a valued workforce, up there with, our nurses, with our allied health, with our, with our medical medical physicians, that we're all in this together, and that we as Aboriginal health workers and practitioners walk with you as health professionals, not as a sidekick to give you access to communities. We're actually a valuable part of the team.
Couldn't have said it better myself. Thank you so much, David.
Not a problem. Done and done.